I think eventually insurers will have to adapt. There's no other way. They can't continue to follow the money tree without making changes and adding on some new things. What I really see happening is employers will start playing a much bigger role in the health of their employees. We're already seeing many, many products now that are directed just directly to employers. There's products around, the most recent one was around ADHD, which is such a rampant problem right now that we didn't even know about maybe 5, 10 years ago. There's so much of work going on in mental health. All of these could be wrapped as programs that these employers offer their employees as incentives, and many companies are offering that. The other thing is having better wellness miles, giving incentives for people just like the air miles. We build wellness miles into the equation so people can use that to take holidays or do whatever they want if they're building in those miles into their program. So we have to think about it differently in every shape or form of what health is meaning today and what does it eventually move towards in the future. So it's not, I think the stakeholders in healthcare will change also in the next 20 years dramatically.
Hello and welcome to another edition of Health Beats, brought to you in association with Abu Dhabi Global Healthcare Week. If you're going to be anywhere between the 14th and the 17th of April this year, make sure you're in Abu Dhabi for the event. It should be a good one. I'm Steve Gardner. I'm your host here at Health Beats, and if you haven't already subscribed, you'll find us on Apple Podcasts, Spotify, all the usual places you find podcasts. And actually, if you haven't subscribed yet, why haven't you? You've already missed out on some amazing content. Talking of amazing content, today I'm joined by Reenita Das, a futurist, a healthcare innovator, a superbly well knowledged individual in Middle Eastern healthcare who I've known for some years now. Reenita is Senior Vice President at Frost Sullivan and spends her time thinking about what the health systems of the future look like. So that's the first question we'll be considering over the next hour. Reenita, firstly, thank you so much for joining us. So Reenita, I guess the starting point here is you. You're in the unenviable position of being able to future gaze, to think about what the future of healthcare looks like. But let's start with your past. What's your journey been to kind of get to this point in your career?
Wonderful. Yes, it's been an amazing journey of almost 3 decades and across 10, 12 countries in the world. I started my career in health primarily because I wanted to work with something that had an impact in the world, basically human. And what better profession to choose than health? Because that's the biggest asset that we can all have. But somewhere along the road, I realized that the system of healthcare was not really working for us as humans. And it was a system that was designed with very different goals and rationale in mind. So I set about deciding to look at how to change that system. And one of the stories I wish to share today is really one of the pivotal moments that I had. It was in 2008. I was about 15 years into my career, very much looking forward to how we can adopt technology in hospitals. And I was working with a company in California called Kaiser Permanente, and they're a very large HMO. And I was working on some projects with them as a consultant. And I remember one day I met the CEO of the company, Bernard Tyson, an amazing, amazing human being who had a huge impact in my career. And he came to my into my office and he said, what do you think we can do in terms of making more money? And I said, well, Kaiser's doing really well. We are making a lot of money. And he said, no, I mean, making money by keeping people outside the hospital. He says, I don't want people to come into my hospital. And remember, this was in the 2008, 2009. That concept didn't exist. He said, I want to keep people in their homes. How do we make money doing that? And I said, you're building a hospital. We need to start thinking differently. So he said, come back to me with a plan. And I think that day was really the day that changed my view of what health is about. And we started a plan of looking at prevention, at screening, looking at people before they get sick. And we started a campaign, which became a world class award winning campaign called Thrive. which everyone in healthcare knows about. It's a pretty intensive campaign talking about how do you thrive. And really, my mission from then on has been all about thriving. It's all been about wellness and how to keep our numbers growing every year from 4 billion chronic disease patients to about 5 billion chronic disease patients over the next 10 years.
So that's a really interesting point to jump, I think, straight into. Let's dive head first into how we think our health systems are going to change over the next sort of 15, 20 years. And that point about the preventative agenda and the creation of a shift from sick care to healthcare, keeping people out of hospital, stopping people from getting sick in the first place rather than putting things right, making people better. And it's interesting that you use the example of Kaiser Permanente as a US provider, because I wonder what you think in terms of how we shift incentives. Because at the moment, to me, there is an issue. I talk about this, as I'm sure you do, all over the world. There's an issue around the fact that insurers and providers don't have at the moment, or don't seem to have, the right incentives to concentrate on prevention. You know, in most health systems, the provider is paid based on the amount of intervention stuff that they do, the volume-based payment model. The insurer has tension with the provider around how much intervention is provided. And as a result, what ultimately ends up happening is insurers are used to kind of, something goes wrong, put it right, rather than stopping something going wrong in the first place. How do we shift those incentives to make sure that everybody is aligned in that kind of triangle between patient, provider, and payer?
So, the Kaiser Permanente model was the beginning of what we call value based care that Obamacare brought in. Um, the rest of the world is just beginning to understand what that is. In reality, we haven't really implemented value based care because we are still in the basis of selling volume. We're selling unit shipments, we're selling products. We're not really selling a service, we're not really selling an outcome. So I think only when we start looking at healthcare as an outcome driven business, which is what is the outcome? How quicker can I get well? How much less products do I need to use or less drugs do I need to use? How many less hospital readmissions do I have if I'm a stroke patient? Then those incentives will be realigned. Another area that I'm working on is the whole concept of wellness insurance. We don't have insurance to keep us well. We don't have insurance in many countries to do basic screening, like basic mammograms or pap smears or all the basic tests. A colonoscopy in many countries, when you're over 50, you need to have that. We don't have that in so many countries. So these basic tests need to be done. So we need to be thinking about wellness insurance and incentivizing all parties in the healthcare ecosystem towards that. And I think that will make a big change. But until we make that happen, the costs are going to be from 10% of GDP going up to almost 30% of GDP. And I mean, most countries can't afford that anymore.
So are we thinking then that value-based healthcare, outcome-based payment models, if our time frame, we're talking about what health will look like in 2040, do you think by 2040 we'll have cracked this nut and we'll actually have true value-based care?
I think there's a number of different forces that are playing. It's not just going to be what healthcare providers and systems are doing. We have a tremendous tsunami of change that's happening between consumers today. And a lot of that change is coming out of basic wearable technology that is coming out of tech companies. So we're seeing the huge consumerization of healthcare that is happening. So really what I see by 2040 is what I call the IKEAization of care, where you actually choose different blocks and pieces to make up what your needs are. So if I have needs to track my blood pressure, my cholesterol, my hormone levels, et cetera, my glaucoma test, I would then choose as an IKEA which products I need and create a bundle for myself and use that. I see that happening tremendously over the next 15, 20 years. And I see eventually all of us having digital twins, and we're having gender specific digital twins because, again, a male body, a female body anatomy is all different. So I think these are the big changes that I see that we are going to work on. And my goal is that everyone should have a health risk assessment done. Everyone needs to have that. So by the time we're 20 years old, we know what our health risks are going to be, and then we can take action to prevent that risk. And that model will slowly start changing. Now, will providers be leading in that model? In my view, no. I think it's going to be a team sport. Healthcare is a team sport. It includes the family as part of the team. So we really need to think about it differently. It's not the responsibility of the clinician or the doctor or the healthcare provider to take care of the patient.
It's a really interesting point that you raise. I love this idea of consumerisation because I think to some degree this is going to be led by Gen Z. You've got a group of individuals coming into adulthood who are far more aware of their own personal data, who are far more aware of their own healthcare, and are far more responsible about the way that they look after themselves. So that consumer demand piece, I think, is really interesting. I also wonder what you think around the role that employers are going to play in that consumerisation agenda. Because again, if you look at healthcare insurance as it stands at the moment, it doesn't consider productivity, it doesn't consider wellness as an element for the insured individual, whereas a corporate organisation has far more incentive to keep someone at their desk, to look after their mental health, to make sure that they're not stressed. Do you think we're going to see a shift away from the traditional insurer? Or will we end up with insurers adapting to this brave new world?
I think eventually insurers will have to adapt. There's no other way. They can't continue to follow the money tree without making changes and adding on some new things. What I really see happening is employers will start playing a much bigger role in the health of their employees. We're already seeing many, many products now that are directed just directly to employers. There's products around, the most recent one was around ADHD, which is such a rampant problem right now that we didn't even know about maybe 5, 10 years ago. There's so much of work going on in mental health. All of these could be wrapped as programs that these employers offer their employees as incentives, and many companies are offering that. The other thing is having better wellness miles, giving incentives for people, just like the air miles. We build wellness miles into the equation so people can use that to take holidays or do whatever they want if they're building in those miles into their program. So we have to think about it differently in every shape or form of what health is meaning today and what does it eventually move towards in the future. So it's not, I think the stakeholders in healthcare will change also in the next 20 years dramatically.
No, without a shadow of a doubt. And it's interesting that you raised the point about ADHD. If we look back to look forward, if you go back 15 years, rather than what we're doing now, looking forward 15 years, ADHD is one of a number of conditions, COVID being the most really obvious one, that we just weren't aware of.
Mhm.
How do we build that sort of future proofing into our health systems? How do we make sure that we're resilient enough with our future health systems to deal with those unexpected new conditions, new diseases, pandemics that are coming down the track, because inevitably there'll be more of them?
Yeah, this is a very good question, Steve. We just finished a very big study with one of the public sector clients here on looking at emergency preparedness for another type of pandemic and whether countries really are prepared for pandemics. So I think people have begun to wake up and realize that they need to have the infrastructure in place. Do they have enough OR rooms? Do they have enough isolation wards? Do they have enough ventilators? Do they have enough clinics? How do you quickly change a country in terms of emergency preparedness when an emergency strikes? So I think we're doing a lot of best practice mapping. We're doing benchmarking around that, looking at different countries. I think Singapore and Korea are just exceptional. They're on the top for all some of their numbers with emergency preparedness. So there are other countries that need to do a lot more work to get there.
Another point that you raised in the previous piece that we a couple of minutes ago was the point around digital twins and the point around the necessity to have gender specific digital twins. And I know that you've done a lot of work around female leadership in healthcare, around femtech. Again, looking at our future through our future gazing goggles, do you think we will have righted the wrongs of gender specific healthcare? So, in other words, do you think that by 2040 there will be equity in terms of treatment, in terms of research, in terms of spend, in terms of understanding of women's health, as opposed to just the kind of male health agenda that we've seen in the past?
Sadly, I don't think so. 2040 is just around the corner for me, and I don't think so. Right now, 4% of research funding goes on women's bodies. 4%. So it's still very, very low, and the numbers are not going up. So there's a phenomenal amount of work that needs to be done. I think the biggest area that women are struggling today with is the fact that we don't have enough data. We don't have enough data, which means we don't have enough knowledge. We're having drugs that are tested on men most of the time. We don't have actual processes and solutions for women for the diseases that they suffer from. Menopause, for example, is a big one. We're just beginning to do studies, and I'm looking at two studies that we're doing right now, looking at the impact of hormones and the brain and whether that leads to higher rates of Alzheimer's because women are having higher rates of Alzheimer's than men. So we're just beginning to make some correlations, looking at the gut and the brain. That's another big area. So I don't think in 15 years we will be able to have, complete equity in health for women. I think what I hope to achieve by 2040 is that we at least have a better understanding of what is causing these diseases. We have a better screening system in place for women so that every woman can get the test done that she needs. And I think a lot of the apps and the consumer products companies have started flooding the market with so many different solutions that women are starting to use many of them that have access.
I wonder if you agree with me on that point then, that, if we look back, again, we look back 10, 15 years, and I remember having conversations about the expected rise and dominance of digital healthcare. The very beginnings, I think, 15 years ago of thinking about app-based technology, about use of data, about population health. And for me, there is a piece here about if you want to look at as an investor where you should put your money right now from a digital technology and healthcare point of view. Do you agree then that femtech is going to be a bigger and bigger component of healthcare over the next 15 years? Or if not, where would you put your investment dollar?
No, I definitely think the femtech movement started because we needed it to put a label to it. In my view, I think we've outgrown femtech. If I say this out loud, yes, I'm saying it out loud, but I think we have outgrown it. I think there's a lot more that we need than just a name called femtech. We need a whole ecosystem. We need the whole world and the planet to come on the same page of it. And we need to look at it as mainstream. So I don't want to put names to it. It was great to put highlights to it now, but now I'm at a point there is that we need to look at it very differently. I want to be able to find solutions for women's health diseases like cardiovascular disease that hits more women more than men, autoimmune disease that increases by 1 in 3 compared to men and women, dementia, Alzheimer's, old age issues. So many of them. I want to go into mainstream women, not just limited to reproductive health. And I think the whole femtech movement came out of reproductive health.
I agree 100%. I mean, I think it is a whole ecosystem for women. And it's a great quote that I heard. I think I did a panel in Dubai earlier on this year on women in leadership in healthcare. And one of the panelists said, I want to get away from talking about women's health and just talk about health. And I also agree with you, we probably aren't going to get there by 2040. So from that point of view, kind of moving on from that a little bit and looking at that kind of agenda, we talked about women's health and the development and the research required to get to that point of equity. What about female leadership in the health system? Again, I mean, I saw some amazing examples coming out of the Middle East, particularly, where I almost felt that they were ahead of us in the UK and the US on women, on promoting female leadership in healthcare. Are we going to get to a point by our 2040 timeline where we've got greater representation of these amazing female leaders in the boardroom? We have reached equity there, do you think?
Not to the level that we're talking about in terms of equality. No, I think we still have a long way to go. If you just look at digital health and where the investments have been in digital health and what portion of women's health we've got out of digital health, it's still less than 10% of dollars that we're getting. So we are still a long ways away. I think it's a systemic problem. It's a problem because we don't have enough women holding the money, and as long as women are not holding the money and the purse strings, it's going to be difficult. As soon as we find that women do that, we get much more money. You take the example of MIDI, for example, or Maven, who were the two largest companies that got the largest funding. The reason why they got that funding is because they were backed every single time in all their series by women funders. That's why they got the largest share of money. Now you can say that are men not funding women's health? No, we're still not there yet. So I think until that money tree is rocked a little bit and we get more women into the system, it's not going to change. I think we're getting definitely better. I think the Joe Biden Foundation to set up $300 million for research was a tremendous improvement in the world today and a benchmark. And I hope we can get that money out with the change of political regime that has happened in the United States.
I'm glad you mentioned the political point because I don't think we can really have a sensible conversation about where healthcare is going without considering the far-reaching effects of the current political turmoil that we're seeing around the world. And I want to relate this to our conversation about women and also to ask a personal question because when I chaired the session in Dubai, one of the first thing that I felt I needed to do was justify and give an understanding of why I, as a liberal white male, was chairing a panel on women in leadership in healthcare. And I think it's really important to kind of really think about the role of men in promoting women in healthcare. You know, what we shouldn't be is male saviors in any way, shape, or form. But I do believe that there is particularly with the political situation at the moment, there is a vital need for male advocacy. What would your advice to me be as a man who cares passionately about seeing greater diversity of decision making in the boardroom, for which we entirely need women's views and opinions, who wants to see that move towards equity in healthcare? How can I, as a man, help with that agenda?
I think that's a great point, Steve. I think the biggest thing that we can start doing, each of us individually, man and women, is to start building CEO pipelines, which include women in the pipeline. We never think of what is the pipeline of women that are going to be CEOs and how do we build that up? Who are the potential candidates who can fill that pipeline? And we start mentoring these women to get up. So in the next 5 years, they would become the next CEO of the company. So we have to kind of put that perspective and that shade of lens into the system, into the boardroom, that we need to say that it's not lip service that I have one or two on in the pipeline. No, I need to have a whole pipeline of women that are going up the ladder to that CEO position. I think that's one of the ways to do it. The other is obviously mentorship. I think we all need mentors at some point. I spent my whole career without any mentorship. Unfortunately, I think for younger generations, there's so many because for us there weren't any mentors, unfortunately, and very late in life, some men stood up and started supporting us. But for many of us, we didn't have mentors. But I think that's being changed because now younger women have many of us as our mentors, and I spend a lot of time mentoring women in their 20s and 30s now.
And from that point of view, I'd like to give a shout out to my business partner and the CEO at Healthcare World, Emma Sheldon, who is, if you want a great example of an inspiring female CEO, there's one. So any young ladies listening out there, Reenita is one person to reach out to, Emma is another. I think it's a really good point that you raise around mentoring and uplifting the female leaders of the future. Moving on then, I want to come back to another point that you raised about money and about investment, because we're talking about 2040. We're talking about how healthcare will develop and how healthcare will change. One of the things, of course, that takes time to mature is an investment. So I wonder if I gave you a few $1 million right now, where would you invest it in healthcare? Where do you think that we'll see the big growth and return for investors wanting to put their money into healthcare right now?
I think there's a lot of big areas that we can invest right now. Anything to do with gut health is a big one for me. So, any products that can be gut health related, any products around aggregation models of selling, which makes products easier to come to consumers with. I think other areas, diagnostics, anything to do with home diagnostics. I think tests that can be done in the house easily and accessible without sending back and forth results. These are things that will give power and the control of us humans, I think, at the end of the day. So very simple things. I think we don't have to go into too much of scientific jargon and very technical details. We need to make healthcare very simple. And I think so far we have made it very, very difficult. The barriers have been made very, very high. We need to make it very simple, just like a simple Apple Watch or a simple iPod, simple.
Really, really interesting point actually about simplicity, and it's interesting there that you didn't go for the sort of digital health or the app based economies that we've seen a lot of investment go into the last few years, but we're talking there specifically about diagnostic areas and particular conditions. One of the questions I think around the digital health and the technology piece. This is a big question, this one, so be ready for it. By 2040, are we going to have cracked the interoperability nut? Because at the end of the day, to me, one of the biggest things that's holding us back from a digital and technology point of view is our inability to make different digital systems, apps, data, etc., talk to each other. So where do you think we'll be on that? Are we going to be able to kind of get our data and our records and our information out of one system and into another, and indeed maybe even into the hands of patients?
Yeah, so I think this is differing by level of technology and country. For example, in a country like India, we don't even have medical records in hospitals, so it's very limited. So the curve there and the thought process there of how to implement digital health will be very different. We'll be leapfrogging a lot of generations of what we've learned in the US and look at it differently. But I do think eventually the control is going to be in the hands of the consumer. I think consumers will have the ability to crowdsource the data and go to places where they need it. So if I have a rare disease or I'm thinking I have a problem, I will give my data to an organization that can use it to give me a solution. So the power will be in my hands. And that crowdsourcing will actually let go many of the middle parties in healthcare that have been making money so far. And I think that business model will overtake. So I think there's going to be two aspects of it. One is where the patient will have the information and control it and be the one deciding where that information is going. The second aspect of it, I think, is that we're going to see a whole breed of um, wellness officers or coaches come into the system. Now, these are going to be clinicians who might be converted into wellness coaches, and they would be similar to our financial advisors. If we want to do stocks and shares, we go to a financial advisor. They tell us how to where to go, where to play, and we pay them commissions based on the profits they'll earn. So I do believe these wellness coaches will be similar to us for our health. They will do a diagnostic evaluation of our health and then give us some feedback, and then they'll be paid based on how well we keep healthy or not. Maybe.
It's a really interesting point, actually, about wellness advisors being similar to financial advisors. Because I don't know if you agree with me on this, but I've long thought that if you want to understand the future of healthcare, go and look at finance.
Yeah,
Because actually, from a technological point of view, from a data point of view, from a
absolutely.
governance point of view, it always feels, doesn't it, like healthcare follows finance.
Absolutely. From going from physical banks, which we used to do before 20, 30 years ago, and we could just go between 9 to 5 to doing it online, anytime, anywhere on your phone, and we have control of it, not the bank. The same system for healthcare. That's why I believe eventually it's all going to be in our hands. And that's where a lot of the parties and the stakeholders will change. And if companies are not changing their business model today and looking at the new models, they're going to be probably out of business in the future.
Couldn't agree more. I think at the end of the day, roll on the day when your health record and your personal health record is no longer on a doctor's computer, but is perhaps on one of these things,
Right.
and you're the one that's able to kind of create that interoperability. Here's another really interesting one, and I'm loving this conversation because we're a whistle-stop tour of global healthcare in 2040. Another big question. universal health coverage. It's been a UN sustainability goal. The original intention was that we would see global universal health coverage by 2030. I think it's pretty much universally acknowledged now that's not going to happen.
Mm-hmm.
Will we see true universal health coverage by 2040?
It's hard to say. With the current administration and what is happening right now in the US, it's anyone's bet. I mean, with what's going on with Social Security now in the United States, I would not put my money into that right now.
It's a really difficult one, isn't it? It's a really difficult one to understand in terms of how are we going to uplift lower income countries when aid funding is being pulled back at such a great rate, when the WHO is not getting the funding that it needs. It's a really thorny one. Probably let's stick to more pleasant topics and more optimistic thoughts. Or maybe not. Will we, by 2040, all be under the control of the AI overlords and the robots that are going to rule the world, or will AI be a benefit to us in terms of how we deal with our healthcare? What's the future where AI and data is concerned?
Yeah, that's a good question. And I think it's going around in every conference. We talk only about AI and we beat it to
Isn't
death.
it?
And you know what I think about AI today? We're at the baby stage of AI today in healthcare. I mean, we're just talking about conversational AI most of the time that we're actually practicing. You know, we have a chatbot, we have an icon, and we use an app to fill in our information and do our check-ins, etc., and set up appointments. It's not really AI that is really happening. So I think it's going to take a long, long time. And I think we don't have the foundations in place for AI truly to happen. If you look at the foundations, do we have 5G in all the countries? Do we have interoperability you just talked about? Do we have data security, privacy? I mean, everything. We don't have that. So there's no point in us focusing on an AI technology to the level that we're doing unless we have these foundational technologies working in the way they need to. I was recently in Saudi Arabia working with hospitals on cloud, and many of the hospitals don't even have cloud systems. And here we're talking about AI. So if you don't have the foundation models in place, it's going to be a long way for us. The regulations are not there, definitely. So I'm not that optimistic about AI, although, you know, I talk about it. I think it could change our lives tremendously. It could help us. It's doing some great work in radiology for looking at images and giving us results in 3 minutes of a mammogram or an ultrasound or an X-ray. So we have had a lot of success in that, but we still have a long way to go, and we have to get the clinical community educated on AI. They're being left behind. We're running conferences without having clinicians part of this. We are having nurses are not part of this. They are very, very critical part of the transition.
You've only got to look at the example of digital transformation. It's going on right now. We're seeing older clinicians having systems installed in their hospitals or around their clinics that they don't understand, that they don't know, that are not being properly socialized to them, and they're just not using them. You know, if you don't bring the clinical community along on the journey, you're not going to see that kind of digital change. Never mind starting to think about using AI. I completely agree with you on that point. And then there's also the issue of AI has to be trained on data, and we don't have the data. Yeah, where that to me is a really crucial question.
And that's the question I was talking about with women's health. How can we do AI for women when we don't even have data? When you type in, give me a picture of a doctor and a nurse, you get a male man as a doctor and then you get a female woman as a nurse. I mean, that's basically, we don't have a lot of diversity in our voices in the data.
Absolutely. And will we by 2040 have worked out how to aggregate data at scale? And when I say aggregate data at scale, I mean, will we be able to share healthcare data across borders? Because at the moment it's siloed in individual countries, and in a lot of cases, siloed within those countries, within individual providers or payers. Will we? I guess that's the next question. Will we be able to share data at the scale we need to in order to have the impact on population health, precision medicine, and the creation of AI? Will we be able to do that by 2040?
We are definitely on the road for some of that to happen. There's already a lot of research institutes all over the world that are sharing data, and they're doing amazing work. The UK is one of them. So we've already started sharing data from a research point of view, which is really the foundation. Once we share data and give access to people of research, that automatically leapfrogs us a couple of generations. So the starting is already happening. We're talking about a lot of councils and associations that are talking about sharing across borders. So I think that one could be possible by 2040, could be possible within limitations.
Is it going to require legal change, though? Are we going to have to see countries starting to adopt data laws that will allow that data transfer to take place?
100% data security and privacy and laws to safeguard that data is very critical. They've already started. Most countries are working on that. We still have a long ways to go, but I do think that one could be possible in certain aspects. The research definitely.
Mm. And I guess that also links to the conversation we were having earlier on about the consumerisation of healthcare, about people taking control of their own data. Because at the moment, of course, what we have is a lot of fear, a lot of people worried about data security, worried about sharing their healthcare data. Do you think that we will have a population that has a real understanding, A, of the necessity and the vital nature of being able to share data at scale and share their medical records in order to help the whole of humanity, and a little bit less protectionism and concern from people about that data? Do you think we'll have got people to that point of understanding their healthcare data?
I think our demographics are changing tremendously. And if you say in 15 to 20 years, 30% of the world is going to be under 30. And their way of looking at data and security and protection are very different. It's not the same as it was with our generation. So I do think we're looking at a very different population that's going to come into the space of health, and their views are going to be different. And these are the people who are going to become and lead the companies. So obviously, there will be a change in 15, 20 years of people who are going to be the next generation of leaders.
Mm-hmm. And from that point of view, we talked about whether we'll have access to the data at scale and presumably also at quality. The question then is also how much will we have done with it? So, for me, at the moment, we're at the very beginnings of thinking about population health and precision medicine. Where do you think we will be in 15, 20 years' time in terms of our ability to deliver on the promise of population health and precision medicine, on the ability to predict the healthcare issues and the healthcare problems of our populations and provide the interventions to help to mitigate them?
I think in some areas we're doing very well. For example, for cancer, we've done a lot. We've made a lot of progress in looking at the whole ecosystem of cancer management and treatment. And there's so much of research and knowledge that we've had and we've invested and we continue to invest in cancer. So I think there is going to be, it's going to be pockets by pockets and diseases by diseases. I don't think it's going to be across everything that we're going to be able to do that. I think the whole ecosystem is going to change. We're not just going to look at healthcare from the perspective of drugs or devices, but really how much we sleep, what we eat, what neighborhood we live in, what access to, gyms we have, for example, or exercise, and how many hours we work. So I think it's going to be a 360-degree contribution for that change. And many of that contribution, part of it is coming from non-healthcare companies. The Amazons, the Facebooks, they're the ones that are controlling consumer data. So that's going to change a lot, I think, in the future, because these are going to be companies that are now going to be using it in different ways. And we already know some of the political ramifications of what is happening with data with them. So it's anyone's guess, but I am hopeful because we've made a lot of progress, and I do think, yes, can anyone say that today I will get the right product at the right price at the right way delivered to me, when I need it? No, but can that happen in the future? Definitely, I definitely think it can happen. It's happening already in certain aspects.
Here's another really big one for you. What do you think the health system or the ideal health system of the future looks like? For me, at the moment, you've got that broad spectrum, that broad scale from the UK and the NHS, where it's funded out of taxation, free at the point of delivery, to the other end of the spectrum where it's the US and it's entirely insurance based, and entirely based around your ability to pay as an individual. And actually a lot of the sort of social parachutes, if you like, of Medicaid are being eroded because of the political situation. Where do you think we'll be in that spectrum? Where's the ideal health system of 15, 20 years time? You mentioned Saudi Arabia. Their transformation program looks really fascinating. Is that an area? Is that where we're going to end up? What do you think?
That's a big question, Steve. I think it just has to be based on the culture of the country, the political, social, economic. We can't change that for reality. We can't standardize everything. I think different countries will have to opt for situations and systems that work based on what they have to pay. Ideally, a socialized form of medicine should be there. I mean, that should be the goal, but that's very lofty at this point to think about it. I mean, I think of a country like Africa, which is going to house the largest population of the world in the next 20 years or 30 years. And where are we with healthcare there? I mean, there's so much of great stuff that is going on, but who pays for it? So it's all very difficult questions today. And I think we're working in little, I think, as I said, small baby steps to plant the seeds, and hopefully they'll grow into tall trees.
No, absolutely, and it's a real worry, I think, in terms of kind of where that social parachute sits as we get towards more corporatized health systems. What happens to the individuals that fall out of insured systems is an incredibly thorny question. And look, you wouldn't be enjoying this if I was asking you easy questions. I've got to ask you the tough ones,
No,
otherwise it
not
doesn't
at
work.
all. Not at all, Steve. My pleasure.
So the next point then that comes out of that, and you mentioned sub-Saharan Africa, which I think is going to be the engine room of healthcare over the next 20 to 30 years. Where will we be on workforce? Because we've talked a lot, and I've done a lot of work with Jim Campbell at the WHO on this around sustainable migration, along the idea that we're looking at being potentially 20 or 30 million healthcare workers short by 2030, although those numbers have improved slightly over the post-pandemic years. Will we have the workforce that we need? Will technology have taken a role in reducing that requirement? Where do you see us in terms of our healthcare workforce in 15, 20 years' time?
I think we have to first define what a healthcare workforce will be in 20, 30 years' time, because it's not going to be in the way we look at it today. A doctor's job description is no longer going to be the same as a traditional doctor. I think education will have to change tremendously. We've already started that education process in many, many colleges and medical schools already. So that has to change. And what is the new workforce that will be required to meet the needs of the new population? We have aged countries like the US is going to be an aged country, whereas we have the young countries like Africa, India, all of these countries that are going to have 40, 50% of the population that are going to be in the productive years. So there's going to be a huge change and shift. I think it's an exciting time to relook at things because the balance of power is going to be transferred. So if these are the populations that are going to be the workforce, then do they control then the technology and the development and the innovation that is happening? Where is that going to happen? Who's going to be sitting in the seats of power for that?
Mm-hmm. It's interesting in terms of the location that our future workforce comes from as well, because I was doing some work on this recently, talking about if you look at the supplier countries of the present, the Philippines, India, Pakistan, etc. Countries where you had rapidly growing economies, large families, and therefore a lot of young people, and rapidly growing educational opportunities that meant that there was a supplement of workforce. That's going to be Africa, isn't it, in the next 10 or 15 years? That's where our healthcare workers are going to come from, is it not?
Absolutely, absolutely. And we need to start building that workforce. We need to start, just like India has become a global center for nursing care. If you look at all the nurses, the largest exporter of nursing has happened out of India. We need to build workforces like that. Philippines is another area of nursing care. So, similarly, we need to start doing the same thing in Africa.
And investing in those health systems and investing in their education and training provision. I think if wealthy nations that are reliant on the global market for their healthcare workers were to start investing money in the education and training of systems of those countries, it would give them an obvious opportunity to then start pulling that workforce from those parts of the world. I think that's a really fascinating point. We're running out of time. We're getting close to the end, which is such a shame because there's so many things I'd still love to talk about. I want to talk about primary care. I want to talk about the agenda of moving the theatre of healthcare from a facility, whether it's a hospital or a clinic, and into the home. Will we, in 15 years, still be, when we're sick, being sent off to a building full of sick people to go and see a doctor? Or are we going to be at that position where, what proportion of particularly primary care do you think is going to be delivered in the home?
In my view, in 10, 15 years, primary care as we know it will be dead. There won't be a need for primary care, because what is primary care? It's basically day to day, care, vaccinations, mother and child care, all of that. So if we are being treated mostly in the house and we're having diagnostic tests and we're checking our blood pressures and monitoring our whatever diabetes, glucose, blood glucose, etc., we won't need that. We'll have all the data, and those data will be electronically sent to virtual clinics, and we'll have doctors in virtual clinics who we could have consultations with. And if necessary, then we would need to go and see someone if we're asked for. But I think in the way primary care is today, it's not going to happen.
Well, you heard it here first, everyone. Primary care will be dead in 15 years. Um, Reenita, we're out of time, unfortunately. I think, thank you so much. We've covered so many topics. We've covered so many different areas of healthcare. My head is spinning. I could have done another hour of this. Thank you so much for your time.
Thank you.
I hope you've enjoyed it.
Me too.
Great, thank you so much. Let's do this again sometime. It was great fun. So that's another Health Beats in the can, and what a great one it was. Primary care is dead. Healthcare will be democratized, it will be consumerized, the world will be very different. Unfortunately, we will still see an inequity between men and women in the healthcare arena. Let's hope that one we make more progress more quickly on. But thank you very much to you, Reenita, for a great hour of conversation, and we'll see you on the next edition of Health Beats. Thanks for watching.